We are starting a Spiderman package, and I left it, we did start it one day before we have done, so I'm not starting on page 1. Page 3, if you will, those who are not here, make sure you go on page 3. It's all in the sides here. Come and pick up your package, anybody who needs it. And so just come, get that package on the side. And I'm on page number 3. On page number 3, we finished up till peritoneal dialysis on 27. And on page number 3, I will talk about lumbar puncture. Lumbar puncture is a procedure. It's in neuro, very important for meningitis patient or patients who is having fever and they want to know why someone is having running temperature. And patient is going for lumbar puncture. Lumbar puncture, very important that we must know. Now here it says only after the procedure. I want everyone to add there before lumbar puncture. Number 1, consent is important. We must get the consent. Invasive procedure. What is invasive means is going inside the body. When they are saying non-invasive, that means you are not inserting inside the body, but we are inserting the needle. And what do you do before procedure? We all should know, tell the patient, empty the bladder. So 2 things, consent, empty the bladder, and where do they insert the needle? L3, L4, lumbar area in the spine. Then I want you definitely to know the position during the test is fetal position, fetal like a fetus, or sideline position. So not on the back would be after the procedure. This is during the test. What position do you put the patient during lumbar puncture? You put them on fetal position. What is the meaning fetal position? We are bringing head close to the knee. And so you can get the needle into L3, L4. So everyone, for exam, we all should know consent, empty the bladder. Position during test is sideline position or fetal position. A lateral, sometimes they write, but the best position is fetal position. After the test, you guys have in there, in your package, is placed in supine. And that means on the back. Patient, after the procedure, you lay them on back. Why? And it says here, to prevent, add there, to prevent headache. And for 4 to 12 hours. Even after 12 hours, maybe second day, patient complains headache. What do? Put the patient on in the back position. So after the test, you lay your patient on the back. Why? To prevent leakage of, write down the word, cerebral spinal fluid. What fluid can it drain from there is cerebral spinal fluid. So remember, we got to keep the patient in that position. So everyone should know lumbar puncture, position, empty the bladder before, after the patient procedure is a supine position. Patient complains headache. The best, before you call the doctor, put the patient on supine position. I'm going to move on myasthenia gravis. It's also in your neuro chapter. If you have not done, make sure we know more. But I want you to add as we will move on. There are 3 lines they have on myasthenia gravis. Myasthenia crisis, you have second line, and cholinergic crisis. The first line is myasthenia gravis. On the top, I want you to write down what is myasthenia gravis is. Lack of acetylcholine. Everyone should know. What are we missing here? Acetylcholine. That's very important in some question. You need to know acetylcholine is less in the body. And what muscles are affected? I want you to add there voluntary muscle. It's a muscular weakness. Patient with neurological problem. Our neuro system is with the brain and the muscle. So what happened? Patient muscles are very weak. What kind of muscles are affected? Voluntary muscles. Voluntary means you cannot breathe. Your muscles, you want to talk, you cannot take out the voice. Your muscles are very weak. Swallowing. So what muscles are affected? In our body, we have two muscles, voluntary, involuntary. Involuntary muscles are, you don't do anything and they're automatically working. But when in neuro system we talk about the muscles are affected when we have lack of some chemicals in our body. So what is myasthenia gravis is lack of acetylcholine. You got to memorize. And what muscles are affected is, what are the muscles are affected? Voluntary muscles. So that's important. Then what is myasthenia gravis is, it's in your first line. It says worsen with exercise and improve rest. Highlight the word rest. What do we need here? The rest. What is important here for your patient? Any question? Patient is admitted. All when the muscles cannot do anything, you cannot function. Rest is very important to give strength for your muscle to work better. Everyone is okay? So what is it important here? Patient is admitted. They must be on rest immediately because rest would help them to give more strength. Next is myasthenia crisis. What is myasthenia crisis? Positive reaction to tensulin. Everyone should write down highlight the word tensulin. Now some question, they will give you the tensulin test. So when they give you, what is a tensulin test is? Tensulin test is only in myasthenia gravis. That's a medication. They give injection of tensulin. So highlight the word tensulin and they give injection. Now some question they will say, how do you know? What are we giving tensulin? To see a patient needs the medication. A patient has myasthenia gravis. So what test we are doing? Tensulin test. And tensulin test means you're injecting the medication. Now here it says, it is positive. So when they are saying positive, I want you to understand the wording may be a little different. Positive means patient has myasthenia gravis. And what is the positive means are, I want you to write down the muscle would improve. If muscle don't improve, no improvement, that is called your negative test. So when you do the test, how do you know it's positive and negative test? So they give tensulin, and when they give tensulin injection, these muscles were weak, and it's called positive when the muscles are stronger. When the muscles don't do anything, that means it's negative. Patient does not need the medication of tensulin. Everyone is okay? What is myasthenia gravis is a test which is done for tensulin, and muscle will improve means negative. Improvement is positive, no improvement means negative. Everyone, two wording very important that we know. What is tensulin is the medication you are giving. Cholinergic crisis. What is cholinergic crisis? Too much of medication. Underline that. Caused by, underline the word excessive. Page number 3 on myasthenia gravis. On the bottom, on your Spiderman package is myasthenia gravis. It's in neuro. You must know completely. And that's why I'm explaining some part. And if you will add there, memorize that. And especially if you're taking exam. And just before exam, very important that you clearly know the disease. So what is myasthenia gravis? Lack of acetylcholine. What is important for your patient here? To give them rest. What test we are doing? We are giving tensulin injection. When you give tensulin injection, muscle improve means is positive, no improvement means is negative. Negative means patient don't need the medication. If it is positive, you are giving more medication. That means patient require your tensulin injection and other medication to treat the myasthenia gravis. What is cholinergic crisis? Word is too much of medication. Patient is taking too much of medication. That is called cholinergic crisis. in cholinergic crisis, excessive medication. What do you do if you have cholinergic crisis? I want you to add on the side is antidote. You will need antidote, and what antidote is? Atropine sulfate. So write down on the side, atropine sulfate you're giving as a antidote when they have cholinergic crisis, okay? And what would you do? Stop medication. That means too much of medication patient has, and you're not giving more medication. Everyone is okay. 3 lines here. Myasthenia gravis, too much lack of acetylcholine. How do you know is the disease is positive? By giving tensulin injection. What is cholinergic crisis means are too much of medication. And what do you give them here is antidote. What antidote you will give them? Atropine sulfate. Everyone is okay? 3 wording here. Now, I want you to write down on the side. If they give you, this is not enough. And in neuro chapter, you got to know more than this. Now, if they give you, there are so many questions on myasthenia gravis can be asked. So if you don't remember or you don't know, I want you to add on the side. What is the priority as a nurse if you have a patient with myasthenia gravis? Write down on the side, respiratory. Their muscles for breathing. So everyone write down the word respiratory problem. So what is the meaning respiratory? That means their muscles are weak and they will get easily, so number 1, respiratory. They're having a problem in breathing. Second one, I would say, is write down the word swallowing. And third one is the problem with the patient is swallowing problem, respiratory problem, and third one is the word is called ptosis. What is ptosis means? Their eyes are closed when they're laying. That means drooping of eyelid. These are, your eyelids are, they're drooping, they can't open their eyes. That means drooping of eyelids. In your question, they will use the word drooping. That means their eyes are not open. They are so weak, they can't leave their eyes open. Number 4 is their voice. They cannot talk. And what kind of voice is? A shrill voice or soft voice. Everyone, we all should know these 3 or 4 things here in neurological with patient with myasthenia gravis. Now if they give you, you are a nurse, you are admitting a patient who has myasthenia gravis. What do you do and what do you teach your patient to prevent this breathing problem? What would you do as a nurse? Number 1, turning and cough breathing exercise. So remember the wording, you are preventing pneumonia. So what do you do? Cough, deep breathing exercise. Cough, deep breathing exercise. And keep in the room suction. And maybe if they have tracheostomy, that's okay. In case they cannot breathe, you will have tracheostomy, that's okay. Number 1, very important, suctioning, cough, deep breathing exercise, and prevent them from cold. And prevent them from what? You will be pneumonia. So remember, your questions are, if you know one word, you can answer your question. So patient has myasthenia gravis. What are we preventing patient from myasthenia gravis? Breathing problem, airway problem. What do you monitor when you have your patient? What would you teach them? Cough and deep breathing exercise. What are we going to keep in the room? Suction. What would you monitor your patient airway and make sure they're breathing? Maybe oxygen saturation. Maybe that's one of the questions. So remember, is myasthenia gravis is lack of acetylcholine. That's number 1. And I told you myasthenia crisis means low medication and cholinergic crisis is too much of medication. What do you do as a nurse if you have a patient with myasthenia gravis? Prevent them from pneumonia. Prevent them from breathing problem. And maybe they can talk and swallowing. What do you do for your patient for swallowing question are? Number 1, always your patient must be sitting upright. Don't leave them in bed and feed them. Why? The risk for aspiration. So remember your aspiration question. What do you check on your patient who's having swallowing problem? Are they pocketing the food? Are they chewing their meal? Are they swallowing? And how do you encourage for swallowing? Remember, whether it's a severe question, whatever, when they're swallowing, you tell the patient to flex the neck. Remember always the word what? Flexing. When you're flexing, the food it opens up more your swallowing passage and the food is going in the back. Same thing, you always keep suction. What is the risk is here? Aspiration. Then third one, patient has ptosis. Maybe they are drooping eyelids and maybe you might have to give them medication, and for eyes problem, check for eye infection maybe there. But a lot of questions are, you are admitting a patient with myasthenia gravis. What would you assess? What would you see in your patient? Answer maybe a ptosis. So what would you see? Patient is laying, their eyes are closed, they can't even open. When they're talking to you, their voice is not coming out. What does it mean that you are admitting a patient who has a history of myasthenia gravis? Everyone is okay so far, what I said, and I want you to add 3 drugs here. Everyone, remember, you got to know the medication. What are the 3 medications I want you to add here? It's called, one is tensilon, we already talked about that, and 2 more medication is called prostegmin, and another one is mastinin. So write down the word prostegmin, Prostegmin, prostegmin. And second medication, mastinin. Very important, we all know the drugs here. Prostegmin, mastinon, and third one, tensilon. When they give you a question, when you're giving drugs, when do you give the medication? In your answer, 30 minutes before eating, so they can eat better. Remember, when do you give medication? 30 minutes before eating. So write down that. And do not change their medication timing, because they must take the medication timely. And so those are your questions, and you got to connect with that. So I'm done with myasthenia gravis. Make sure you memorize like that. If you know what is myasthenia gravis, lack of acetylcholine, tensilon test we should know. Myasthenia crisis means they need more medication. Cholinergic crisis means they have too much of medication. What do you do if somebody has too much of medication? Number 1, stop the medication. Number 2, you have antidote. And what is the antidote? Is called cholinergic crisis. Antidote is atropine sulfate. What is your priority as a nurse for myasthenia gravis patient we said respiratory, number 1, swallowing, ptosis word, and the voice of your patient. If you remember like that, that's good, and that is the way we need to know about myasthenia gravis. Now I'm going to go head injury question. Now I want not only just there is a medication for head injury, but let me write down a few things. Now this is the way we learn how to connect our question. Patient is admitted with head injury. What can happen with head injury? Remember, they're bleeding. And what is the word can be? Maybe subdural hemorrhage or epidural hemorrhage. Subdural or epidural hemorrhage word. That means they're bleeding. So first thing, either you're getting question, patient has subdural hemorrhage, means they're bleeding. Epidural hemorrhage means bleeding. Head injury means patient has injury to the head. What are you going to monitor when patient has subdural, epidural, or head injury question? Number 1 is ICP. What is ICP? Is increasing intracranial pressure. What is increasing intracranial pressure is? Number 1, your vital sign. What happened in the vital sign? Increasing blood pressure, decreasing pulse, decreasing respiration, everyone should know increasing blood pressure, increasing systolic, and decreasing diastolic. This is the way we have to memorize, because many questions they're not going to write increasing blood pressure. There may be question increasing systolic and decreasing diastolic. Are we clear? And that is one word. Decreasing pulse and decreasing respiration. What else is increasing here is temperature. What is your brain? Is controlling body temperature. What part of brain is controlling the body temperature? Hypothalamus. So we must monitor for temperature, the vital sign. Number 2 is, second thing everyone should remember, what are we monitoring in ICP question are level of consciousness. Number 3, pupil reaction. What is in the pupil reaction? I want you to add there in pupil reaction is your pupil are constricting. That means they become small. This is good word. That means no problem. But if they give you in question, pupils are dilated. That's not good. That means they are having increasing ICP. Now, I know we all remember the word parla, but your question may not be the word parla there. There may be a question, you are bringing the flashlight, and what happened to the pupil? They are dilated. Dilated means is what? ICP is high. These 3 things are very important. Immediately we monitor our patient. Now what is in the brain? Everyone remember, in endocrine system, what gland do we have in the brain? Is your pituitary gland. What do you monitor? So what are we monitoring in head injury questions are? Number 1, maybe ICP, they might throw the word, maybe level of consciousness, maybe they will throw the word pupil reaction. Now next thing is, remember, may not be anything ICP. Maybe your questions are pituitary gland. What is pituitary gland does? Producing growth hormones and ADH. Very important for our exam, and everyone should know pituitary gland, ADH, and growth hormone. So they're not going to be asking on head injury too much on growth. What would be really immediately affected is antidiuretic hormone. And what will happen? There is no ADH. Head injury is there. And when you have no low ADH or non-ADH, what happens? Your body is having what disease? We call diabetes insipidus. And what happened in diabetes insipidus? And they did not say all these words. And they say patient is admitted with head injury. What would be patient is complaining here? And remember the word polyuria. What is the other word is polydipsia. Are we clear? And what happens if you pee more? They may be asking, because that's a urine, and they might say, do you give water to your patient? Yes, increase fluid. What else would be there? Maybe they're saying monitor urine, a specific gravity. What happens when you pee more? A specific gravity is going to be low. So remember, your questions are not only head injury, just to know one thing is ICP. Keep in your mind, what is your questions can be either ICP or number 2, diabetes insipidus. Now, when you have head injury and you have open wound, what can it lead to? I want you to add number 3 is meningitis. Infection can go to the brain and lead to meningitis. So number 1, everyone remember ICP. Everyone remember diabetes insipidus. Everyone remember the word meningitis. What is the early sign of meningitis is knuckle rigidity. Now we have more sign of meningitis, I won't go on that. But number 1, patient has a head injury and patient has knuckle rigidity. Everyone should know what is knuckle rigidity. Immediately they will say you monitor for meningitis. Another question. You are draining the fluid. What fluid are you losing here in head injury? Cerebral spinal fluid. How do you monitor cerebral spinal fluid? Positive for sugar. Everyone, we all should know positive for sugar. Last one, when they did not give ICP, but what are you preventing head injury patient? Seizure. Write down the word seizure. They didn't ask you all this, and they're saying, patient is admitted with head injury. Where do you keep this patient? Non-stimulating environment. Why? To prevent seizure. See how do you cover your whole topic? So what are we preventing here is seizure, and what kind of room you will give? Quiet and non-stimulating room. Now what is ICP is? There is a blood or there is a fluid, and what happened when ICP is up is called cerebral edema. So you guys have only one line there for in your Spiderman package. What medication do you give when your patient has head injury is mannitol. Are we clear? I want you to highlight the word mannitol. Everyone should know what is mannitol. It's called osmotic diuretics. It's a diuretic. Another question is, what do you monitor when you are giving is mannitol? You lose potassium. Write down on the side. What are you monitoring when you're giving mannitol? Is potassium. And because it lowered the potassium level. Everyone is all right. We are monitoring by giving. And I also want you to remember, nowadays in your question could be, what all, as a nurses, what all the drugs can you give when patient has ICP or patient has head injury? Remember, you want to prevent them from seizure. What medication do you give them now? Head injury? Write down seizure medication, convulsion. Even they don't have a convulsion, you don't want them to have seizure. And you're dilantin, any seizure medication you can give them. Number 3, what are the other medication you can give? Is steroids. The steroids is, why do you give steroid? To reduce inflammation and swelling. Are we clear? So see how you connected ICP question, what medication we are giving here is number 1, diuretic. One of the medication is your mannitol. You are giving mannitol. What are you monitoring when you are giving mannitol? Are potassium. And what do you, and increase here? Urine output. Maybe another question. See how your questions are? So we all need to know. And what happened patient with ICP are cerebral edema. What are you preventing them here from seizure? So I wanted to go over head injury. You covered a lot of things on head injury. You already know ICP. You already know what do you monitor for ICP. We have some packages here if anybody need it. You can just pick it up from here. Now, next is, I will move on liver biopsy. On page number 3, liver biopsy is you are taking the piece of liver. Where is the liver? Is on the right side. Everyone should know, right hypochondriac region on the right side. Patient is going for liver biopsy. Liver biopsy can lead to bleeding. Can you do the blood test for bleeding and clotting, right? So any questions on liver? Liver is on the right side. And what test do you do? Bleeding and clotting test before you do the procedure. Why? Because it's a risk for bleeding. Any biopsy. Biopsy means you're taking a piece and it can lead to bleeding. But liver can be very highly for bleeding. So remember, liver question, any questions are there? Do the blood test, fine. Consent is very important. It's an invasive procedure. Before procedure, what would you do? It says prothrombin test, so highlight. It's a blood test, right down on the top. Is what position do you put the patient during liver biopsy? They can lay on the back because liver is on the right side. For some reason they can lay on the back, you can turn them on the left side. So the right side is on the top. Everyone is all right? After the procedure, what do you do? Lay them on the right side and put the pillow under the liver side. Sometimes they use the word hypochondriac, but remember, patient is laying on right side. Pillow underneath. Why pillow? to prevent from bleeding. So everyone should know on your liver biopsy question. And also, what do you teach patient? Now, they're asking you, patient has a liver biopsy, patient is going home. What would you teach your patient who is going home? Number one, no lifting. Number two, prevent them from cough. If they're having cough, why? When you're coughing, what happens? They can bleed. And number three is constipation. What do you prevent them from constipation? So three things are important: prevent constipation, coughing, lifting. So remember, anything is addressing there, because what happened when you cough, you sneeze, what happened? The pressure. And then no lifting is always good until the doctor's order, or maybe 1 week. So any questions are, everyone must remember the word is liver biopsy for bleeding, and liver is on the right side. I will move on, is the word diarrhea. Everyone should know. Yes?
So post-op for liver biopsy, you lay them on the right side?
Right side. Patient lays on the right side and put the pillow. That means on the stomach. They're laying on the...
Before surgery is left side?
Before surgery, patient can go on the back, or you can turn them on the left side, because you want the top, the right side. Before surgery, on the back, or turn them the left side, because you want the right side up. After surgery, they can lay on the right side, and more like laying on a stomach and put the pillow. So basically, you're laying on the right side. Are we clear? Why? Because you're applying the pressure. After the procedure, patient is going home. You got to prevent them from bleeding. Your questions are, patient has chronic cough. Patient is scheduled for liver biopsy. What do you teach patient when they're going home? Is give them cough syrup. You don't want them. See how your questions are? Not at any straight. You got to do critical thinking. So first thing, we all know the liver is on the right side. Before procedure, they can lay on the back. If for some reason they can lay on the left side, so right side is up. After procedure, they lay on the right side to prevent bleeding and prevent them from coughing, sneezing, anything, and lifting, constipation. Give them stool softener, because when you constipate, you're applying the pressure, and that can lead to bleeding. Next is diarrhea. Everyone should remember the word diarrhea. You're losing a lot of metabolic acidosis, and when you're vomiting, you're losing a lot of acids, is called alkalosis. So these two words are important. Whenever your questions are vomiting, you're going for alkalosis. You have NG tube suction. What is NG tube suction? You're removing the fluid from the stomach. Same answer. What are you monitoring your patient? Metabolic alkalosis. What are you losing? Sodium and potassium. Underneath, I'm going to go on myxedema, a little bit again on endocrine system. I like important wording, so make sure you guys add there and memorize. We all know what is hypothyroid. Your thyroid gland is low. And how do you monitor your patient who has hypothyroid? What is the word is called for hypothyroid or myxedema? You guys have there. Remember, people, what is thyroid gland does? Everyone should know main wording for your thyroid glands is producing your thyroid hormones. And when they are low or high, is affecting what part of the body? Is basal metabolic rate. What is basal metabolic rate? Is metabolizing whatever we are eating. Metabolism is fast or metabolism is low. So remember, hypo people are low BMR. Hyper, when they are saying, is BMR is high. So we must remember the word hypo means your body is not metabolizing. That's number one. Some question, maybe only you have word for BMR. So BMR is important word. And what is your thyroid gland is producing is thyroxine. Thyroxine, and maybe they're saying T3 and T4 are low. What is high here is TSH. So you're looking for what level here would be high, TS set. But what is it low? As the level goes high, you need to increase the medication. What medication do you give when you have hypo patients are? Is called thyroid hormones. Everyone, we all know synthroid, but many question, they will not give synthroid and they will say patient is taking thyroid hormone. That means when you're low in hormone, you are giving hormones. When you have high hormones, you are giving anti-thyroid medication. Everyone is okay? So what medication we are giving here is thyroid hormones. And that is your Synthroid. I want you, everyone write down Synthroid. And second medication, Cytomel. Sytomel. So write down that word. And there's another medication is called Armour hormones. A-R-M-O-U-R. Armour. And Cytomel. Synthroid. And the wording is thyroid hormones. Everyone is okay? What are we giving? Thyroid hormone. What is low in myxedema? Everyone should know. What is low here? BMR. What is high here? TS set. What is low? T3 and T4. So what happens when patient has low BMR? They are slow people. Are we clear? Physically and mentally. That means they're not very hyper. But if you have hyper patient, they're overactive people are. So remember, myxedema questionnaire, they give you what is the patient is. That means they're slow physically and also mentally. That means they're very slow. In mentally, a lot of questions, maybe only they're saying mentally slow. That means, yes, they have very slow. So you have physical and mental. They are cold, underline that. And what else I want you to highlight that word is cold, and they are, which is very important, constipation. So keep that in mind, they are gaining weight. They are gaining weight because why? Their BMR is low. So everyone, now I will just say a few things. Number one, they are slow. Number two, cold. We all need to remember, anywhere they have cold, that's your hypo. Number three, constipation. They have constipation. Number four are, very important is, for them are, their blood pressure is low. And also, the pulse rate is low. What do you monitor your patient here for CHF? Cardiac problem, because their heart is working slowly. Their pulse rate is slow. You already know the three drugs we said you're giving are Synthroid, you're giving them Cytomel or Armour hormones. Weight gain, very important that they remember they are cold, they're constipated, and number four is we said their vital sign and they gain weight. Because their body is not metabolizing. So that is your hypothyroid patient. What do you monitor patient? Maybe your answer cardiac problem. Maybe your answer mental problem. What diet would you give them? They're gaining weight. Don't give more food. You decrease calories. What do you increase here? Fiber. Everyone is okay? What do you cut down their diet? Cholesterol. Why? Cardiac problem. So everyone make sure we add their cardiac problem. Weight gain is there. BMR word is slow. Medication, we already said Synthroid, and I said Cytomel and Armour hormones. Let's move on, page number 4. On page number 4, you have Graves' disease. So I will cover on Graves' disease and write down the main wording and just memorize. You don't have time to go back. Some of you are going maybe soon for the testing, but anytime, this is the way I like you to memorize. Now, hyperthyroid. What is hyperthyroid patients are? They call, what are we called hyperthyroid? Graves' disease. What is high here? BMR. What are they are? BMR is high, And what do they complain? For your, in your package, you have increased physical and mental function. What does it mean, increasing physical and mental function? I want you to write down what are these problems they have. These patients are nervous and irritable and insomnia. Very important. Next is nervousness, irritability, insomnia, maybe mood swing. Very important. These answer, because they're going to ask you, what room are you going to put the patient who has hyperthyroid? Alone. Why? Because they're mood swing and they're very irritable. They're very nervous. What room are you giving here? Maybe separate room, not with anybody. Cold room. Decreased stimulation. Non-stimulating environment. And cold room, alone room. Very important that these symptoms we all know. How your questions are more, how do you admit? How do you take care of your patients? So remember, they're very nervous people. They're irritable. And they have insomnia. They have mood swing. Alone room, cold room, stimulating room. Number 2, their blood pressure is high, and especially systolic pressure. So the blood pressure is high, and also they have increased pulse rate. Number 3, they're hot. And number 4, they're losing weight. Those are very important in your mind, and they're overactive, very nervous. They're very irritable. And what medication do you give them to treat them? Are anti-thyroid medication. Now, this is not thyroid hormones. Anti-thyroid medication. What are anti-thyroid medications? Some of you have PTU and prothyrosil. And number 2 is any other medication do you remember? Is, what is another one? Tapazole. Everyone should know these 2 drugs, very important. Tapazole, very good. Number 3, Lugol solution. And number 4, radioactive iodine. Radioactive iodine. Everyone should know PTU is, they may use the word prothyrosil. Anti-thyroid you're giving for hyper patient. You are giving PTU. You are giving tapazole. You are giving your patient, the medication is tapazole and prothyrosil Lugol solution. They will ask you, how do you give Lugol solution? You mix it with water, you can mix with juice, you can mix with milk, and patient should be given by the, use the straw and give them in a liquid form. Radioactive iodine, they will be prevent from radioactivity, and that will be coming out from the body. So that means is the gloves and gowns when you're using for them and prevent from radiation. So remember, PTU, tapazole, very important, and these 4 medication. But the next line, you guys have thyroid strong. So what is another treatment for hyperthyroid patient are thyroidectomy. Now, what would you monitor patient for thyroidectomy? I want you to write down few things, that way you are done, and you must know the main thing, and everyone should know thyroid gland is in the neck. And what is on the top of your thyroid gland is parathyroid gland. And what do you lose when you have thyroidectomy? So everyone, I know we all know a lot of things about thyroidectomy, so I will go faster here. Number 1 is your teaching before patient is going for thyroidectomy, is positioning. What do you tell your patient here before thyroidectomy? Use their hand to support the neck when they are turning or moving in bed. Why? Because if they're rough, it can start bleeding and stress on the suture line. All your patient teaching before surgery should be done before patient is going for surgery. Very important that you teach them when they're using, what are they using? Supporting the neck. So write down the word support the neck. And how do they support? By using their hand when they're moving and turning. Number 2, what would you keep in the room? Tracheostomy. And why do you keep? That is important. We all know tracheostomy because they're losing calcium. Because accidentally thyroid gland has been affected by parathyroid gland when they're removing, because they're so close. And when they damage parathyroid gland, what happened to the patient? They're losing calcium. And what happened with low calcium is not all the time we think about fracture, but you won't be able to breathe. Your muscles are affected by low calcium. Tracheostomy, you are keeping in emergency, patient is not able to breathe, and I will talk about low calcium. So tracheostomy is in the room. What do you have your patient position? Semi-Fowler's. What do you monitor after surgery? Airway, number 1, because of calcium. Number 2, bleeding. What do you discourage patient from bleeding? Coughing, and what? Clearing the throat. So remember, how patient, when they have thyroidectomy and you cough and you do clearing the throat, it can risk for bleeding. And some question, you have, what do you put in the care plan not to do for your patient, and what would you teach your patient here not to cough and not to clear the throat? Why? Because mostly we teach patient cough and deep breathing. Here, you are not going to teach. Why? Because the risk is what? Bleeding. What is the risk is here? Airway. So tracheostomy we have, Semi-Fowler's position. For bleeding, positioning is important. And now, where do you monitor the patients for bleeding? In the back. Front is okay, but you must go in the back of the neck and monitor for bleeding. A lot of times the blood is seeping and going in the back. So where do we monitor the bleeding? You are looking here, but the blood may be going in the back. So look in the back of the neck of the patient and under the shoulder and the bed sheets to monitor bleeding. Now, these are very important. Patient come back and doctor has ordered, when patient is coming back, is calcium gluconate. And they're asking you, why does the doctor has ordered calcium gluconate? Your answer is to prevent tetany. And what is tetany? Is twitching of muscle. So these are some questions. Now, I want everyone to know complication of thyroidectomy. What are the complications of thyroidectomy are? Number 1, yes, bleeding, airway problem, but main one, I want you to remember, the word is called tetany. Why is tetany? Because of they're losing calcium. They won't be able to breathe because they lost calcium. And that's why very high care on your patient. Number 2, second word, very important, is laryngeal stridor. What is a laryngeal stridor? They cannot breathe in. And anytime you see laryngeal stridor, what do you do? Not to document, call your RN or call your doctor. Patient is not able to breathe. Number 3 is hoarseness. What is hoarseness? Is damaging the laryngeal nerve. Patient says, I cannot talk. My voice is hoarse. It's almost 4 days. That means maybe the nerve and the laryngeal nerve and the muscles have been affected. And thus, how do you check the hoarseness? Tell the patient to say, ah. When patient says, ah, and you can hear the voice, that means is positive. So what do we monitor here is the hoarseness. Then last one is your thyroid storm. This comes after surgery, complication, and also a patient has been infection or during surgery. What is a thyroid storm means are too much of hormones, thyroxine is in the blood, and they're turning more hyper. Are we clear? So everyone make a very clear, what is a thyroid storm? They're more hyper, like hyperthyroid. Now what does it mean? Now you guys will move on. On the second line, it says the word thyroid storm. What is a thyroid storm? Increasing temperature. They're hot. Increasing hypertension. I want you to write down severe diarrhea. They're losing fluid. They're high temperature, high blood pressure. What do you do when your patient is in thyroid storm for your NCLEX? Number one, medication. What medication you will give? Tapazole. PTU. Same drug we were talking. Everyone write down for your exam is your medication was Tapazole. We talked about that, and PTU. That's your medication you're going to give, IV. And what do you do? Their fever is very high. Lower the temperature. Cooling mattress, maybe patient would need it. Increased fluid. IV fluid may be your answer. And when you're putting on a bed, cooling mattress, in your question, what do you do as a nurse? You cover it with a sheet. Why? Too cold, you're laying patient on the mattress, the skin can damage. So remember, what do you do when you're putting somebody on a very cold mattress and the water is running very cold? Any cold application, don't apply directly to the skin, because what does it damage? The circulation. So remember that word. And what medication do you give here? Cut down fiber. Why? Because they're having diarrhea. Anti-diarrhea medication, tapazole, fluids, and also check their vital sign and lower the blood pressure. Everyone is all right. Post-thyroidectomy, we already said the word, semi-Fowler's position. We already said prevent neck flexion and hyperextension. Tracheostomy in the room. Don't overextend, don't hyper, because you want them to breathe. So position is your semi-Fowler's, extension, hyperextension, we avoid them. Everyone is okay? Everyone should know for your NCLEX, 4 important complications are tetany, laryngeal stridor, hoarseness, and thyroid storm, and the medication. We are on Spiderman package, page number 4, and hypoparathyroid. Now I'm moving. So thyroid gland, post-thyroidectomy, you guys know, thyroid storm, you know, and thyroidectomy position, you know. So we covered that. Now what is hypoparathyroid? Before I move, we all know parathyroid gland is producing your calcium. What is parathyroid is maintaining? Write down the word calcium and phosphorus. Not only you think about calcium, but think about phosphorus, balance of calcium and phosphorus. Page number 4, and if you don't have the package, we have some packages here, and you can pick up the package. So, hypoparathyroid. Remember, the word is parathyroid gland. Now, which patient has hypoparathyroid? Number 1, your thyroid gland, I want you, parathyroid gland is producing, is called parathyroid hormones. Low parathyroid hormones, you have low calcium. And second reason is thyroidectomy. See, your questions are not always there. Maybe they're asking you, when do you monitor patient for hypoparathyroid? Number 1, your parathyroid gland is not producing calcium. Number 2, you are monitoring patient after thyroidectomy. Are we clear? So what is hypoparathyroid? I want you to write down one thing. They have low calcium. And what is high here? Phosphorus. So lot of question. It may not say to increase calcium, but what can be your answer? To decrease phosphorus. So when you decrease phosphorus, automatically your calcium would increase. Everyone is okay? Hypoparathyroid means low calcium. Why do we have low calcium? Your thyroid gland is not producing enough calcium. And where do we get calcium? From parathyroid gland. What are the two things we got to keep it in mind? Calcium is very important, we all need to know. And calcium balance comes when you have phosphorus level is same. So your answers are going to be not all the time increased calcium. Patient has low calcium. What do you decrease in the diet? Phosphorus. As your phosphorus level goes lower, your calcium is going up. So remember, one thing is your answer, increased calcium. Number two, remember decreasing phosphorus. Now, what do you do if you have a patient? I will talk about the symptom here, but I want you to get clear concept. And what do you do if your patient has low calcium? In IV, number one answer, you give calcium gluconate. Calcium gluconate. And second thing, answer is your diet. We already said in diet, you increase calcium and decrease phosphorus. So number two, diet. Number three, you can also give them parathyroid hormones, which is called Fortico, F-O-R-T-C-O. Write down the word. That's a parathyroid hormone. So what is low here? Parathyroid hormone. How do you treat them when we have low calcium? Either you're decreasing the phosphorus or increasing calcium in the diet. In emergency, patient can die. You've got to give IV calcium gluconate. And second thing, what do you increase in your medication question? So you already know about endocrine parathyroid gland. So what medication do we give them? Calcium gluconate. And second word, I wrote it down here, Fortico, F-O-R-T-C-O. And you give that medication patient in parathyroid hormone. So you are giving in forms of hormone. You are cutting down phosphorus. What is your goal is here? Increasing calcium. Are we clear? Now, questions are, what do you already know? Calcium low after thyroidectomy, laryngeal stridor, I said, breathing problem, all that problem. But let's remember the word cats. In your notes, you guys have the word cats. C-A-T-S is here in your notes. And what is C means is convulsion. Convulsion. So everyone should know. Maybe your, C is not one simple question. Your patient has low calcium. What are you preventing your patient to go into convulsion? Maybe you got to give medication also to prevent convulsion. So what are you expecting with low calcium? Number one, convulsions. A means is arrhythmia. What is arrhythmia means? The heart. Your muscles of your heart is not functioning. And what do we have here? All your calcium is affecting the muscles. And what happened in the muscles here? Patient has arrhythmia. Maybe the word is dysarrhythmia. The heartbeats are affected. Then you have, the next word is T, technique. Remember the word? You prevent them from twitching of muscle. And what are the signs for low calcium twitching of muscle? Everyone should know Chovestic sign and trouser sign. Are we okay? And then you have is, we said already, is last S, is stridor. What is stridor? They cannot breathe. Breathing problem. Stridor, breathing problem. So everyone remember, very important is your calcium is affected. What happened with the calcium? Either your gland is not producing calcium or patient has thyroidectomy. They're not going to give you a straight question. They're going to say patient has thyroidectomy. What are you monitoring? Hypocalcemia. What are you monitoring whenever you have low calcium? Is your patient is going, remember the word cats, remember the word convulsion, arrhythmia, heart, and T, technique, S means is a stridor. So what is low calcium is affecting our muscles. Our muscles are not able to function. Don't all the time your answers are going to be fractures and osteoporosis. That comes also later. Yes, if your body is not absorbing enough calcium, your bones are lacking with your bones. So everyone, this is very important in the last line. You increase calcium in your calcium question. What do you decrease in the diet is phosphorus. What do you increase for better absorption of your calcium? Another answer, vitamin D. So remember, calcium, phosphorus, vitamin D. Any question on calcium, maybe they're indirectly they're asking you increase vitamin D or decrease phosphorus level. So that covers your hypoparathyroid and the word for calcium. Now I'm going to go hyperparathyroid. So you're covering now endocrine hyperparathyroid. And I want you to remember hypo means is low calcium. Hyperparathyroid is they're producing too much of calcium. And what would be low here? Phosphorus. Are we clear? So what is high here? Calcium. What is low here? Phosphorus. And now we will go hyperparathyroid. I want you to underline two words. Everyone should know. Number one is there are two wording here is on hyperparathyroid, renal calculi. Too much of calcium, any question? First thing is you remember either your eating question, calcium, or hyperparathyroid. When do you have calcium high? Either you're eating, maybe a question. Person is eating too much of cheese. Person is eating too much of calcium food. What do you monitor? Stone, kidney. You are taking calcium medication. Too much of calcium medication can lead to what? Renal stone. So what is first thing is renal stone. First thing. Second thing is this calcium is high in blood and is not absorbing in the bones. Now you're going into number two is pathological fracture. That means they're having osteoporosis and bones are not getting enough calcium. Everyone is okay. Two things. Hypercalcemia means you have too much of calcium. Where is it floating? In the blood. And is not absorbing in the bones. Now you're going to go pathological fracture. So you guys have in your notes, renal calculi, joint pain, back pain, and I want you to write down pathological fracture. Hyperparathyroid patients they have too much of calcium. What do you cut down? Even they have too much hyperparathyroid, but they have too much of problem in the bones. Are you going to increase the calcium here? No, because it's already too much of calcium. What medication they will give here? You want to increase phosphorus in your diet, number one. So make sure it's low calcium and high phosphorus diet. Very simple, keep in your mind. You are going to increase what in the diet? Phosphorus. Increasing phosphorus and decreasing calcium. Never pick up answer to increase calcium because calcium level is already high. What would you be giving medication? I want you to write down the word calcitonin. Calcitonin is hormones from thyroid gland and is the medication. So calcitonin comes from thyroid gland. And what medication do you give them here are calcitonin. What do you increase here? Fluid. Diet we already said here. Number one, diet. Number two, drugs. Number three, fluid. Number four is what else do you monitor your patient when they have too much of calcium, or you prevent your patient pathological fracture. What are you going to teach your CNA? Turning carefully. Are we clear? When patient is ambulating, help them to walk. Why? Because you are preventing. Are they going to be risk for fracture? Yes. So what is your responsibility here is to prevent them from fracture. Now, also, those are very two important answers for hyperparathyroid and fatigue. Yes, they feel tired. And the diet we already said, I want drugs, calcitonin. Immediately, your answer would be calcitonin. Let me finish a few things before we take a break. Let me finish hypovolemia. What is hypovolemia? Dehydration. Hypovolemic shock right away. Which patient you have hypovolemia? Bleeding. Diuretics you are giving. Hypovolemia means dehydration. What is dehydration leads to? Shock, right down on the top. Immediately, hypovolemia, patient is losing a lot of fluid. You gave diuretics. What are you monitoring? Your questions are going to be for shock. What are the questions are on shock are? Underline the word hypotension. Increasing rapid pulse rate. That's a sign of your shock. So remember the word hypovolemia, shock. Remember the word dehydration. What do you monitor for your patient are? And what is another thing they will ask you? They get anxiety. I want you to write down on the top is when is hypovolemia, urine output. They will ask you, what do you monitor as a nurse? You're monitoring urine output would be low and concentrated. Are you going to monitor specific gravity? Yes. Less urine output. Mother brings the baby who was having diarrhea and vomiting. What do you ask as a nurse? How many diapers have you changed? As the baby is crying, has no tears. What do you monitor? Capillary refill. Write down. See, you've got to have this information connection. You know, but sometimes we can think. It's called critical thinking. Patient is hypovolemia, dehydration question. What are we monitoring? Their blood pressure you're monitoring for shock, urine output, a skin turgor. We all know skin turgor. And what would be the mucous membrane? Dry. What is the sunken eyes? Dehydration. In the babies, depressed fontanelles is dehydration. So one word I want you to add there, dehydration, urine output, capillary refill, and sometimes they will say check for dehydration. Are we clear? So you got to know. The next one, hypervolemia. Which patient you have hypervolemia? What is hypervolemia? We are retaining fluid here. Write down the word overfluid. Now, what is your nursing care plan for hypovolemia or dehydration? And they're asking you, we are nurses, and they're asking you what diagnosis, nursing diagnosis would be for hypovolemia. Write down the word deficient fluid volume. Deficient word. That would be your care plan for hypovolemia. Hypo means low. Deficient fluid volume. What are you going to make a care plan? Increase fluid. Are we clear? Monitor all these nursing care, what we said. Everyone should know. Questions are your care plan question. You have a patient who has lost a lot of fluid. Or patient is taking diuretics. What does the diuretics do? Dehydration. What would be your diagnosis? Monitor for your patient for deficient fluid volume. Make sure you know the care plan. We are nurses. If you don't know, how can we monitor our patient? Deficient for lower fluid, dehydration. Over fluid means you are retaining more fluid. Which patient are having hypervolemia? This will be, is overload. Write down your care plan. Overload of fluid. And why you have overload of fluid? CHF, renal failure, too much of IV fluids you are giving. Patient is retaining fluid, hypervolemia. What do you monitor when your patient has hypervolemia? What do you monitor hypervolemia? You're retaining more fluid. We all know weight. Weight is very simple answer. We all know weight. What is very important is hypervolemia. And what would you assess? Your patient has congestive heart failure. Patient is admitted with congestive heart failure. What are we monitoring here? Lung sound. And what do you hear when you have more fluid? Crackles. Are we clear? So hypervolemia, page number 4, hypervolemia, underline the word rails and crackles, and dyspnea. They can breathe. Now what position are we going to put them? Raise the head of the bed, and maybe Fowler's position, and edema, underline. Hypervolemia, your blood pressure is going high. Why? Because the fluid is overload. Fluid is low, you are losing blood pressure here, we are going on too much of fluid. I think we'll stop here, take a few minutes break. I'll start